In this edition of Living Well, you'll learn about the role and function of the hospitalists who serve SAMC.
Hospital medicine is a fairly new specialty. It's been around for only 20 years. And most of the hospitals in US have moved to the hospital medicine model, hiring hospitalists. Hospitalists are basically physicians who specialize in acute care medicine.
A hospitalist is like a quarterback in a football field. He will be able to have a bird's eye view of the patient care, and he can integrate the thoughts and the ideas of the specialists and their recommendations and work with the ancillary services to be able to get those things done.
We stay in close contact with the primary care physician, and what we do is we get most of the information from the primary care physician's office, and many of these records, because many of the studies are actually taking place in the hospital system, we have them here. Plus we have the records from prior hospitalizations as well. So that gives us a very good idea when you come into the hospital as what is going on with you.
At SAMC, we have a hospitalist round the clock, 365 days. During the daytime, as more active care is ongoing, we have at least 12 hospitalists working, and during the nighttime, we have 2 physicians all the time staying in-house, being ready for any need patients have and the families have.
We are in close touch with the specialists on each case. We talk with all the specialists involved in each case on a regular basis. We discuss cases, and it helps having hospitalists in the hospital, because now when the specialist rounds, you are available to have that discussion with them, or you have that discussion with him and go later and discuss those findings with the family.
Families oftentimes have difficulty in finding physicians in the past, because they cannot stay with the patient all the time, and physicians usually visit the patient one time. It's challenging for the families not knowing what is going on with the patients. Hence, the hospitalists would be able to help them meet whenever the family is in the hospital, and they can always request the nursing staff to reach out to the physician, and we will be able to walk in any time and explain to the patient and the families about the patient care and able to answer their questions, so that the families can be much more comfortable knowing what is going on with the patient.
Many of the primary care physicians whose patients we take care of, we are in close contact with them as well. We actually visit many of these primary care physicians' offices and try to get feedback from them directly and try to address any problems they or their patients might be facing.
Hospitals being in-house all the time allows us to respond to the inpatient emergencies much more faster.
We are active not just in the hospital, we do a lot of work in the community as well as with the education of the medical students as well. The medical students, they rotate with us during their training in 3rd and 4th year.